Hi, Dr. McDougall. Thank you again for everything that you do. I'm 40 years old, but I was actually born in Ukraine, and up until the age of 9, my family immigrated to the U.S. But I was going to comment to what you were saying is that I did remember the older generation, especially when you travel through the villages, like 80 to 90% of their diet was mostly white potatoes. And I remember seeing a documentary years ago of this older Ukrainian man somewhere in the villages, probably over 100 years old. And he said he hasn't had anything other than a white boiled potato a day for as long as he could remember. And he dedicated it to basically the white potato.
Great,
One,
great.
yeah, I've always, ever since I was a kid, kind of tried to learn from the older generation. And that's something I do remember that we ate a lot of potatoes. I mean, we're from a bigger city, but you saw the older generation, they were sufficed with just having some white potato for dinner, maybe small piece of fish or chicken, but potato was their main course. Um, my question for you is, I noticed for myself personally, I know that you could get poison on some potatoes. For example, I'll buy a big bag of at Costco, and my concern is that, I can't get through it quick enough, and it starts growing the little, you know, the skin turns green, or it starts growing the little roots on the sides. At what point have you ever studied, does potato start losing its nutritional value? Is that something we should be concerned about?
What you're talking about is solanine poisoning. That's what the green pigment is. It's due to spoilage, and you'll get nauseated, maybe throw up. People being killed by solanine poisoning is pretty darn rare, non-existent. And this just points out that you don't want to eat spoiled food. So if you have potatoes that have potato buds on them or green pigmentation, you'd at least want to cut the buds and the green out, if not throw away the whole potato. And just fresh potatoes won't give you that problem. You store potatoes in a cool, dry place, not a refrigerator. And Mary's also got some other suggestions, but it doesn't matter. Yes.
Great. Thank you, Doctor. Up next, we have Marla. Marla, if you would go ahead and unmute yourself, and we'd love to have your question for Dr. McDougall.
Thank you,
Let me
Dr.
add some. Let me add some to that last question first before I forget. Is you can live on white potatoes and water alone. Okay, potatoes are an anti-scurvy vegetable. They're loaded with vitamin A and C. So underground storage organs, which potatoes are, you can live on these and water alone. Above ground storage organs, which would be things like grains and legumes, they're missing vitamin A and C. So you must add a little bit of vitamin A and C, say a little piece of orange, or a little bit of asparagus or broccoli or so on. So potatoes are great food. I'm sorry, I just wanted to get that in because I was afraid I was going to forget it.
Hello, can you hear me?
Yeah, I can.
Okay, thank you. Dr. McDougall, I'm a longtime vegan, plant-based person myself, and I appreciate your work for so many years from your first book. So I have a question. What do you recommend for a long-time vegan, whole food, plant-based person who has a SNP, a polymorphism of lipoprotein A, elevated lipoprotein A on a whole food plant-based diet? And I have one other question.
You want me to answer the first one?
Please.
Well, if you were my patient, I'd tell you to stop going for the blood tests because you're just confusing yourself. Okay? What you're doing is you're treating fractions of cholesterol, and which laboratories will go in and fractionate to death. Doesn't make any difference. It's the food. And there's going to be no special diet that you go on that you have lipoprotein A, particle size big, small, etc. They're just going to drive you crazy with all these microanalyses. So I'd say stop getting the test done. Just eat right.
Hey, I hear you, and that's a great answer. Of course, it's considered a high risk factor. That's genetic. So
yeah, but what are you going to do about your genes?
Right. There's
let's focus. And besides that, I want to say something else. Most of what people think is genetic. In other words, what they inherit from their parents is an education. See, my parents taught me to smoke. They taught me to drink alcohol. They taught me to eat eggs and bacon. I learned my diseases from my parents. And believe me, I got the same problems that my father had, my grandfather had.
Mhm.
So, this idea that it's somehow tucked away in your DNA really condemns you. You don't have any options. You cannot fix it. So let's fix what can be fixed, which is an education.
Thank you.
Say
The
that.
other question is on, no oil, vegan, like whole food, plant-based, with some nuts and seeds, and let's say flax seeds, chia seeds, hemp seeds, someone who has low essential fatty acids, dry eye, dry skin. I have that from a lot of my patients. I hear people dry and don't know, are asking what to do. And could you suggest, because this is your long time expertise?
Well, I think it is possible that people who eat a very low fat diet develop dry skin, but greasy skin ain't appealing. So I would say that that bit of message is far more important to those with greasy hair and greasy face, and not pretty if you shine like that. So, but I occasionally I would say I've heard about people who develop some dryness of the skin on a low fat diet. I think most of that is actually allergy. They have a little eczema, but let's just say it's due to a low fat diet. Then my recommendation would be to add the oil from the outside, to put it on your skin, and to put some kind of, I don't know what a safe oil would be to put on your skin because it's absorbed. I'm sorry, did that address your question?
I think you nailed it, doctor. Thank you. She's now gone. So we're going to move on now to Lou. Lou, if you'd go ahead and unmute yourself, we're looking forward to your question as well.
Hi, Dr. McDougall. Thanks for everything. What would be your recommendation for someone who's diagnosed with end-stage renal disease? Can the starch-based diet reverse or improve that in any way?
Probably not. Probably not. End stage, you're talking about 10% of kidney function left. But even at 10% kidney function left, if you eat a very, very low protein diet, and I teach how to do this in one of my books called McDougall's Medicine, A Challenging Second Opinion. It's used, I own the rights to it, so I give it away to people. But also, if you go to my website, drmcdougall.com, you look under hot topics, there's a whole discussion about diet and kidney disease. And what it boils down to is we've known for well over 100 years that people who have kidney problems, kidney failure, they get sicker and sicker and sicker the more animal foods they eat. And actually, they naturally are repulsed by animal foods. They think meat is stinky after a short period of time and some kidney failure. If you put people on a low protein diet, and sometimes you have to make it so low that the only way you can do that is to add extra sugar to the diet. Use a diet like Walter Kempner, the Kempner diet, which is you might want to look it up. It's the rice diet from Duke University. And yeah, you can slow or stop progression, but when you get down to end-stage renal disease, that's pretty far. And I'd have to say that I've helped people stay healthier and off of the dialysis equipment for a period of time. And so when will you say it's not worth it to somebody to stay out of that dialysis ward? Well, that's hell on earth. So, the data's there. We've been using this for 100 years, a low protein diet based on vegetable proteins. And yes, it will slow or stop progression of kidney disease. But as far as making the kidney tissue grow back, that would be too much to expect.